So we realized that more and more adults were coming in crisis, and we did not have a safe place to put them. A lot of them were coming in and basically in a somewhat chaotic environment where it was loud and it was not healing for them. And we realized that we needed a better model, and so we went looking for one together.
Since 2006, we have seen a 50% increase in patients with psychiatric and substance use disorders presenting to emergency departments. 1 out of every 8 emergency department visits nationally are for a psychiatric or substance use concern.
In the last 2 years, we were seeing over 3,000 patients in the ER every year, needing inpatient psychiatric admissions or patients with behavioral needs and substance abuse problems. And there was not very conducive environment for the appropriate treatment for them and management for them.
I've been working in mental health for a little over 8 years now. It's a passion of mine. I think everybody experiences their own mental health crises or issues during their lifetime.
The concept was we have to do better. We want to treat them immediately, we want to treat them compassionately, and we want to treat them in an environment that is conducive to psychiatric emergencies, which our emergency department is not.
This was co-designed with some folks who are so-called peer professionals, which means they have lived experience with a serious mental illness. And I think that they helped us bring some compassion in the design of the unit and try to make sure that even the setting itself was therapeutic.
So it's basically just give them a better feeling when they come here, not like a factory set kind of feeling when they come to this setting. It will allow time for healing for these patients so that they don't feel they're like prisoners at some of the places, they can feel that way.
It's not your usual hospital setting. It's very much homey, but safe at the same time.
So I'd almost think of it like a train station. This is a place where you stop, find your next destination, and then you move on.
Hopefully what will be different is when someone gets here, we will have strong relationships with community programs. So we'll assess a patient, say, okay, you would benefit from this community program, you would benefit from that community program. And we hope that people from those community programs will come meet with our consumers in those rooms, get the ball rolling. So we're looking to do those what we call warm handoffs to community programs. So I'm hoping that there's going to be greater integration. Also with law enforcement and the squads who bring patients to emergency departments, increased comfort and familiarity with them as well.
Our team is really developed to help people out and find the best resources for them, whether that be inpatient, medications, and outpatient setting. We really want to interact with our patients and make them feel safe and that this is a safe place to come whenever they need help.
I just want to thank the donor community. They really came out and saw the need for this years ago, because this was envisioned in 2015 from a needs assessment of the community. And they've stayed consistent and true to that vision, and they really helped us build what we think is the safest and most compassionate space for people in a psychiatric crisis.